The next layer up, you have providers using formal EMR systems. We work with a lot of partners, the known names, Allscript, Eclipsys, NextGen, all those EMR providers, and enabling a connection into HealthVault. And some of those have patient portals, which is at the top of the layers. Missy mentioned Epic, they have a MyChart patient portal. That's how that works, where you can see your data and get that glimpse into it. It's that tethered PHR. But a lot of EMRs do not. So we've really spent a lot of time thinking about how to enable those type of solutions. And we have there like what we call direct-to-clinical or our Patient Connect solution. And the way that works is that you basically have an encounter with your physician in the office. Their workflow doesn't change. They just use their regular EMR. They get an extra checkbox where they decide they want to exchange data with their patient. And you get a printout with a secret code on it, and secret question and answer. You go home, go to HealthVault Patient Connect, type that in, and you can enable your data to flow. Again, under your control. We'll talk a lot more about privacy and how those gatekeeping elements work. And then ultimately through the portal, where you do have that rich interconnection with an existing EMR, and where you can also facilitate data to flow into and out of HealthVault. Quick talk about partner momentum. You can see a lot of companies have engaged with us. We're very proud of this actually, with a little over a year. It's almost 16,000 SDK downloads at this point, so that's about 1,000 a month. So there's a lot of activity. We really hit the nerve with this type of solution. And there's a lot of innovation out there, like Missy said. When you saw the earlier slide where we talked about the whole range of health and wellness applications, and the broader segment, things like diabetes always come up when you talk about chronic conditions. Diabetes, asthma, heart disease, those are kind of the big three everybody's aware of, big populations. And so there's a business model there as well because it's so large. But what about those hundreds of other diseases with smaller disease populations where there's 2 million people affected? You see sites like Patients Like Me that started out that way, where you have a sick or affected family member, and you see a startup emerge, where those people are very motivated to go build solutions. We want to stimulate those type of innovations as well. And HealthVault is certainly tailoring as well to that market as they do to Johnson & Johnson or other big companies that do innovative solutions. Device is very important to us. We'll talk more about that. But there's 50 connected devices today, all the way from blood pressure monitors, blood glucose monitors, peak flow meters, digital weight scales, spirometry, heart rate monitors, pedometers. So it's very impressive, and we hear a lot about all the things that are going to happen in the next few years. When we started this, we were really focused on making it happen today. We wanted to make sure we could enable devices that are available at retail today. And those 50 devices, you can go out and buy them at Amazon, Costco, CVS, or Walgreens. They're all out there in the market, available to consumers in a very affordable price range. We have over 40 live application partners across a wide variety of segments already, all the way from condition management, behavior modification, remote monitoring, all the way into some diet and nutrition sides, some of those doctor connections or hospital connections. So we're very proud of that whole range of applications emerging, and we're just seeing the tip of the iceberg of what is happening, as you can see from this big amount of SDK downloads. We did our June HealthVault Solutions Partner Conference. 300 companies showed up there, and they're all actively working on solutions integrating with HealthVault. We did the Be Well Fund. That was an interesting RFP that we did for more of the academic community to build innovative solutions on top of HealthVault. We were overwhelmed by the response. Microsoft does regular RFPs in lots of domains. This was the biggest one in Microsoft history from a response perspective, just to give you an idea on the interest and the need out there. And then over the year, we have also built up more and more key strategic partnerships, big names. We already mentioned Kaiser, Mayo Clinic, Aetna. So you see insurance companies coming in, McKesson, American Well, New York Presbyterian. We announced a very interesting study with Cleveland Clinic involving 3 of their departments and endocrinology around diabetes patients, heart failure specifically, and hypertension, where in some cases people go home, leave the hospital with 5 devices. And I think it was Don Jones that highlighted the fluid retention problem, which is Cleveland Clinic is renowned for its heart failure patients. Those are circumstances where people re-enter the ER for very preventable problems with proper monitoring. That is happening today. So these are huge cost savers. So these are the devices. We're at CES, so I want to highlight those. We have a little booth as well in the CES Silver Summit, so go check things out. We have a great video on how these things work in the real world today. Again, they're available at retail and connected as we speak. I'm going to leave it at that so we can have some room for discussion.